Good evening and welcome to IHW Council's special web series on lung cancer awareness talk show, which is supported by Roche under its public awareness initiative. I'm your host. My name is Anisha Nair. Now, lung cancer is one of the most common cancers seen in India, and the incidence of the disease in our country continues to increase. According to Globocan 2018 report, lung cancer ranked fourth overall amongst the various types of cancer in India. Now, what is most alarming is the increase in cases of lung cancer in a younger population who are non smokers. Another big challenge for the management of lung cancer is that most patients are diagnosed in advanced stages, which is 3 or 4, when the treatment is difficult and death is nearly certain. So, why are non smokers being diagnosed with lung cancer? Why are the number of deaths from lung cancer far higher than those of colorectal cancer or prostate cancer or breast cancer in our country? Is quitting smoking is a sure short way to prevent lung cancer, but for non-smokers, how can one reduce the risk of lung cancer? To discuss this, please welcome our panel of experts. We are happy to have with us Dr. Krishna Prasad, Chief Medical Oncologist, Mangalore Institute of Oncology, Mangalore, joining us now. And please also welcome Dr. Nidhi Tandon, Consultant Medical Oncologist, Mazumdar Shaw Medical Center, Bangalore. A warm welcome to both of you for joining us on our show.
Thank you.
So we have our experts here with us. During the course of our discussion, if there's any question that comes to your mind, feel free to ask them. They're here to answer your questions. You can type them in the comment box of this live post, and do share this page on your wall, to share it with your friends if you feel that they can benefit out of the discussion we have today. Now, a quick introduction of our experts. Dr. Krishna Prasad is the Chief Medical Oncologist at Mangalore Institute of Oncology. He is the first medical oncologist of Mangalore and has has a vast expertise in areas of cancer chemotherapy, hormone therapy, immunotherapy, and new biological therapies in treating solid and hematological cancers. Dr. Nidhi Tandon is consultant medical oncologist at Mazumdar Shaw Medical Center in Bangalore. Dr. Tandon's expertise is in hematological malignancies, breast cancer, ovarian cancer, and lung cancer. She received the Best Thesis Award at the 30th Annual Meeting of Indian Oncology Cooperative Network 2014, amongst the other awards that she has to her credit. Thank you so much for joining us on this web show. Let me begin with you, Dr. Nidhi. Cancer has become commonplace in our country, and you know, uh, it's very mean and very heartless. But if one hears lung cancer, then most people actually, instead of sympathizing, they point fingers and say, "Oh, they must be smoking." They brought it out on themselves. But now, during the course of your practice over the years, even you would have seen that this is now changing. A lot of non-smokers are being diagnosed with lung cancer. So, in your course of practice, what have you seen about this disease, and where is it, poised in our country now?
So, lung cancer is certainly one of the common cancers worldwide and in India as well. It is one of the five most common cancers in India. So, of course, smoking is an important cause of lung cancer, but there are other causes of lung cancer apart from smoking. This includes air pollution, especially it's so rampant. It's estimated about 35% of the lung cancers are associated in some form with air pollution. Apart from air pollution, any exposure to any type of chemicals, dyes, solvents, petroleum products, that may also lead to lung cancer. Uh, Exposure to any form of radiation, whether working in the mines or getting radiation therapy for any other cause like breast cancer to the chest region may also result in lung cancer. Uh, More importantly, I would like to say and emphasize that apart from active smoking, passive smoking is also a major cause of lung cancer. So if you do not smoke, but anybody in your family, anybody in your uh, college group, or anybody in your workplace is smoking to you, and you are getting exposed to passive smoking, that may also result in lung cancer. Um, Nowadays, there is an increase of lung cancer in non-smokers. Um, it's mostly of adenocarcinoma type, and there are certain genetic mutations which are found in these kinds of patients. They can be found in other patients as well, but they are more likely to be seen if the patient is young, if the patient is female, if the patient is non-smoker, especially in Asian population. Fortunately, we have specific therapies available against these mutations, so that helps our case.
Dr. Prasad, what have you seen during the course of treating lung cancer patients over the years in India? Because, like Dr. Nidhi also said, adenocarcinoma is increasing especially amongst women now. Many a times it is assumed that women will not be heavy smokers, and to see them coming with lung cancer. Why I'm saying this is because uh, my aunt, my Masi, passed away because of lung cancer, and she's not a smoker, and she doesn't chew tobacco. She doesn't have many of those high risk lifestyle issues that could lead you to cancer, but she presented in lung cancer in stage 3. We came to know in stage 3, and she survived for a few years, but is death certain? I mean, why is this happening?
So yes, we are seeing a lot of non-smokers coming with lung cancer, but still predominant cause of lung cancer in India is still smoking. It not necessarily be cigarette smoking. It could also be different other types of smoking, BD smoking, non-chewable tobacco. Smokeless tobacco like gutka, what they use. So it could be other reasons as well. But like you have pointed out, we are seeing many patients who are non-smokers, not exposed to any kind of smoke. So the exact reason for that is not known. Like my colleague Dr. Nidhi has pointed out, air pollution is a reason, but we do see a lot of patients from the rural area also coming with lung cancer. It could be related to other things as well, like burning of coal, how they cook their food. So probably the initiative from the government to make sure gas is available to everybody, cooking gas is available, might have some role to play in reducing the incidence. And I'm sure we have many other reasons of which we have no idea, which causes lung cancer. Like you pointed out in your aunt, she might have some genetic issues which we cannot pick up easily. So, but the point is, this same reason is taken by smokers, to argue their point, saying that so many non-smokers get cancer, so why should we quit smoking? So to them, I would say that it's just like walking on the road. Many of us are walking on the roadside. Yes, we do end up with accidents. Some bike person may come and hit us. Some lorry may come and accidentally run over us. It happens. But it is more likely to happen if you are rash, if you are reckless, and if you walk in the middle of the road, isn't it? So cigarette smoking is like walking in the middle of the road and thinking nothing is going to happen. You are more likely to have an accident there. And non-smokers is like walking on the side in the footpath, in which case also you can end up with lung cancer, but the chances are much, much less.
So, Dr. Prasad, worldwide the trend has been towards reduction with smoking. Is this the case in our country as well?
I don't think so. Worldwide, the incidence of smoking is reducing, especially among women. In India, the incidence of smoking among women is anyway very, very low. So I don't think that is reducing. The incidence of smoking among our youngsters is still extremely high. One visit to our malls will let you know that all people standing outside are smoking. So unless, in the US, for example, we are seeing there a reduction in lung cancer, which is because of the fact that in the last 10 years, the incidence of smokers has reduced. But in India, no, I don't think the incidence of smoking has reduced.
And that's a shame because if you stop it, you help yourself. And, while, you cannot promote tobacco and tobacco products, perhaps we need more disincentives by way of higher taxes or, talking about the ill effects more clearly on cigarette packets itself so that people stop doing this. Now, Dr. Nithi, uh, uh, you know, why is lung cancer usually detected so now, we had an entire discussion about breast cancer, and because of the stigma attached to it, because people are not aware, because people want to hide it. That's why it gets delayed. The diagnosis gets delayed. Why does the diagnosis of lung cancer get so delayed?
So, one of the reasons is that lung cancer is quite an aggressive malignancy. Among the other kinds of malignancies, lung cancer is one of the more aggressive kind of malignancies. Uh, Apart from that, you need to understand that still a lot of lung cancer are is seen in smokers, and the associated symptoms would be cough, shortness of breath, production of sputum, some amount of blood in sputum, which is anyways seen in smokers because of the chronic obstructive pulmonary disease associated with smoking. So a lot of times they tend to contribute their symptom if to the COPD because of lung rather than thinking that I may be having lung cancer. So apart from it being an aggressive malignancy, this is one reason that lung cancer is detected at a later stage.
Uh, Dr. Nithi, can you describe what is an aggressive cancer? What does it mean in terms of timelines or the way it spreads, and how is it different from other cancers, say cervix cancer?
So, whenever a cancer uh, is localized to a particular organ, say for example, if it is lung in only in the lung, then what we call it as a early stage cancer. The cancer spreads from there via the blood or the lymphatic system to other organs. When it is in the organ and in the nearby lymph nodal system, it is considered to be advanced, but it is still curable with the present armamentarium of therapies. When it spreads from through the lymph nodes and the blood system to other organs is when it becomes metastatic or the so-called last stage of cancer. And
Sorry, I'm interrupting you, Dr. Nidhi, but this could happen with any cancer, right? Breast cancer can also spread. So, how do you rate it as an aggressive cancer as compared to others? Because I believe cervix cancer is a very slow moving cancer. It takes many years to progress. So, how do you rate lung cancer as being an aggressive one?
so one, uh, the speed at which it spreads to other organs. The other, so for example, if there is a breast tumor, it is easier to detect. If a patient has persistent cough because of lung cancer, he may consider it to be allergy. He may consider it to be a normal bacterial infection, and that is why it is late to detect. Or he may just attribute it to his smoking, and that is why it is late to detect. Also, the speed at which it spreads to other organs is higher in lung cancer. If breast, you compared it with breast cancer, so if a breast tumor goes into axillary lymph nodes, it can still be both operated and removed. But if a lung cancer spreads to uh, lymph nodes on both sides of chest or lymph nodes in the neck region, then it becomes largely inoperable. So, apart from it being aggressive in the way of the speed, it becomes inoperable if it spreads to a lot of lymph nodes in the neck region or both sides of chest, and then that is also one of the reasons that it is considered aggressive. You,
We have, yeah,
and
yeah. So we have started getting a few questions from the audience as well. And Dr. Prasad, I'll request you to answer this question because you have quite vehemently said that you need to reduce smoking if you want to reduce the incidence of lung cancer in our country. One question coming in is, does vaping or e-cigarette reduce the chance of getting lung cancer?
The answer is no. So there's no point in changing from one type of smoking to another type. It just doesn't. So it is as bad as cigarette smoking itself. So there is no easy
So
way out,
you have to kick the bad habits. There's no shortcut
Absolutely.
or alternative. Right. Dr. Prasad, Dr. Nidhi said that, why people don't take symptoms of lung cancer seriously is because they think it is something else, an allergy or another respiratory problem like, bacterial infection. With my Masi also, this was the case. In my mother's side of the family, a lot of people have asthma. My mother has asthma. Her sister has, elder sister has asthma. Her brother had asthma. A lot of my cousins have asthma, but my Masi never had asthma in her whole life. So first the doctor said, "Oh, you have a family history. It must be asthma." Then she got operated for polyps in her nose, and all this was being done, and then many months later she gets diagnosed with stage 3 lung cancer. So are the symptoms very non-specific? How can you get your antenna up to try to figure out that something is really wrong?
Yeah, I think you have hit the nail on the head. It's extremely difficult to pick up symptoms. There is no symptom which is specific for lung cancer. Pick up anything, for example, cough, just like you pointed out, allergy is probably the commonest reason for all of us coughing. Infection is another. Take sputum production or take little bit of breathlessness. Everything can be explained by common illnesses. One or two symptoms which do not occur easily is having sputum stained with blood. That should raise an alarm. The point is, any organ which is entirely inside your body, it's extremely difficult to pick up cancer in the early stage. That is why mammogram and breast cancer is such a big thing, because it is one organ which is easily palpable and where you can pick up cancers early. If you want to pick up lung cancer early in an asymptomatic phase, you need to do CT scans every year, every 6 months too, because just like how Dr. Nidhi pointed out, it's a fast growing cancer. Most of these lung cancers are much fast growing compared to breast cancer. Hence, you need to do imaging, which is more invasive. It's much easier to do a mammogram or an ultrasound of the breast rather than doing CT scans of the chest. So, similarly, you take another cancer like ovarian cancer. It's known as the silent killer for the same reason. Ovaries don't have pain receptors, and by the time you pick up, it is stage 3. So, I think it goes without saying that most of the cancers which start from within your body, it's extremely difficult to pick up. Unlike, say, for example, breast cancer, where you can have screening programs, tongue cancer, oral cavity cancer, cervical cancer, where you can have screening programs. Lung cancer, many attempts at screening have been done, but virtually always the screening is aimed only at chronic smokers who are at a very high risk of lung cancer. So in the general population, say for like your Mausi, there is no way you can pick up these cancers early unless someone does CT scan for picking up some symptom which was very bad. So for example, a severe asthmatic patient, if the symptoms and signs do not correlate together, the physician might think that I need to get a CT scan done.
So then, how do you prevent getting it? Like you said, stop smoking. That is a sure shot way you're going to prevent getting it. Uh, Other reasons could be, indoor pollution, where in our country, women are blowing chulas and they're inhaling a lot of smoke. Now that the government itself has discouraged and is, encouraging LPG connections in every home, etc. Uh, if there is no screening, what other preventive methods can be used, Dr. Nidhi? What to your mind is a good prevention so that you don't get this kind of cancer?
So I will again like to emphasize what Dr. Krishna Prasad said, because I completely agree. First and foremost, quit active as well as passive smoking or tobacco chewing. Second, preventing air pollution is something we can do. Um, Neither um, producing it yourself nor getting exposed to air pollution in any form, be it because of vehicles, be it because of industry, be it because of chulha, or any form of charcoal burning. So these are largely two reasons which are modifiable. There are other risk factors, which, as I told in the beginning, exposure to chemicals or radiation, which can result in lung cancer, but these are all non modifiable. Or if there is a genetic mutation causing cancer, again, it is non modifiable. You cannot do much about it. But all you can do is reduce to reduce the risk is this. As Dr. Krishna Prasad just pointed out, there are screening programs specifically for smokers. So anybody who has more than 30 pack years, and by pack years we mean that one pack of cigarette contains about 20 cigarettes. So somebody who is taking one pack of cigarettes every day for last 30 years and is aged between 55 to 75 years can undergo a CT scan screening for detection of cancer at an early stage. But apart from that, these are the only things we can do to prevent lung cancer.
Dr. Prasad, to your mind, what could be other, preventive measures like Dr. Nidhi has said? Like for breast cancer, we discussed that if you're active, you reduce your fat cells and hence circulating estrogen may be controlled, and then you may reduce your risk. There is also a belief should you do aerobic exercise, your lungs become stronger because their capacity increases, decreases. So, could that also be a way to, try to keep lung cancer at bay, optimal lung health?
I don't think there is any proof to say that active exercises will decrease the chance of lung cancer, but it will definitely contribute to good health. Apart from what Dr. Nidhi has said about quitting tobacco and trying to reduce air pollution, there are some jobs wherein the risk of lung cancer actually increases, say wherever the dust is high. Take, for example, stone masonry, stone cutting, construction workers, demolition workers, pottery, ceramics, glass manufacturers, mining, for example, quarrying, sandblasting. So there are so many industries wherein there is so much exposure to dust, to asbestos, to silicosis. So, I mean, these are the industries where the risk of lung cancer is extremely high. So, in these setups, we can try to make sure that the workers are exposed to better working conditions, make sure they are wearing adequate masks with filters, also make sure where adequate ventilation is provided in their workspaces. So in addition to what Dr. Nidhi has said, I think these are the things which we can do.
Right. Dr. Nidhi also mentioned genetic mutation. So, how do these genetic mutations work when it comes to lung cancer? And are these genetic mutations brought about because of environmental factors?
That's for me.
That's for Dr. Nidhi, please.
So there are certain syndromes which are found in which have a genetic mutation which is um hereditary, but they so these are not carried because of the environment, but these are hereditary. Like Lee-Fromeny syndrome and other syndromes, which are genetic mutations which are hereditary, and if the parents have that, the same gene can be transmitted to the children and they can have. But this is a very rare cause of lung cancer. More commonly, we see in the tumor specimen uh, of a lung cancer patient, we have certain mutations like EGFR mutation, ALK mutation, and ROS mutation. These mutations develop over the course of time and they result in lung cancer in these patients. These are not present at birth and they are probably develop later in the life, which results in lung cancer.
But how do they develop, Dr. Nidhi? Why would A have this mutation and B not have it? Because it didn't pass down the bloodline, right? It
Yeah.
wasn't there when they were born. So how did it come to this?
Unfortunately, as of now, we do not know why these mutations occur. All we know is what kind of people are more likely to harbor these mutations. And as I told in the beginning, it's more common in Asian population, it is more common in females, it is more common in non-smokers, it is more common in young patients, and it is more common if you have adenocarcinoma histology of lung cancer. So these mutations are all common in these subgroup of patient. But why do these patient got these mutations which were not there by birth? Nobody really knows.
That's quite a puzzle there, right?
Right.
So, we got one more question coming in from the audience. Dr. Nidhi, I request you to answer this. Now, a Facebook user is asking, does age affect the survival rate of lung cancer?
So, lung cancer, though is now seen in younger population, is largely a disease of elderly. And if I remember correctly, the average age when it develops is about 65 to 67 years. So, age per se does not affect the survival of lung cancer. Having said that, if a patient is elderly, he is likely to be more fragile. He is likely to have other comorbidities like diabetes, hypertension, heart disease. And because of these reasons, he might not be able to withstand the treatment. For example, um, we may remove a big portion of lung in surgery for a 40-year-old, but a 70-year-old may not be able to tolerate that major surgery. Or I can give chemotherapy, what chemotherapy doses I can give to a 40-year-old, I may not be able to give those doses to a 75-year-old. And because of this, their survival may be lesser, but it is not that if there is a fit 70-year-old who can receive the entire treatment, his survival will be lesser than a 40-year-old.
Right. We've received another question. Dr. Prasad would request you to answer this. A Facebook user is asking, what is the life expectancy of someone with stage 1 lung cancer?
Okay, stage 1 lung cancer is curable in at least 70% of these patients. So, of course, if you take an individual patient, you cannot really predict. If you take,
Yes.
say, 10 patients, you can say over a period of 10 years, 7 of them will be alive and 3 of them will get the disease back. But in an individual patient, it is impossible to say how long that person is going to live. So, on an average, 70% is the 10-year survival rate.
Right. And in your practice, Dr. Prasad, over the years, have you seen younger patients of lung cancer? Because, like Dr. Nidhi is saying, the statistics worldwide is that lung cancer is generally more prevalent 65 to 70 years. Is this what you've seen in your practice? Has it changed over the last few years?
Yeah, I'll just go back to the previous question in the sense stage 1 lung cancer, the cure rate is nearly 70%. I'd like to point out, and maybe Nidhi can also put her point across, that the chances of me seeing a stage 1 lung cancer is less than 5%. So in the other words, at least 80% of our patients are stage 4, maybe another 15% are stage 3, and less than 5% are stage 1 and stage 2. Maybe Nidhi is working in a bigger center, in a bigger hospital, bigger city. Maybe their numbers there are different. So I think it will be interesting to know her numbers. In terms of seeing younger patients, yeah, we are seeing very young patients. For some reason, we are seeing a lot of IT professionals getting lung cancer in their 30s and 40s. And obviously, I cannot pinpoint any reason for that. So unfortunately, yes, we are seeing very young patients developing lung cancer. And just for the reasons which have already been pointed out, it's extremely difficult to pick these cancer at early stages. And many of them we are picking it up in the late stage.
Right, Dr. Nidhi. What would you want to say about the numbers that Dr. Prasad has given us? It's not sounding really very positive.
Yes, so I completely agree with him. Hardly 5 to 10% of lung cancers are seen in stage 1, another 10% maybe in stage 2, but 80% of the cancers are seen in stage 3 and 4. In fact, we have such latest modalities of treatment in which if it is a stage 1 lung cancer, he might not even undergo surgery. He can be just given a special form of radiation therapy, and he can be cured with that. But unfortunately, out of 100, only 5 to maximum 10 are seen in that stage.
So, Dr. Nidhi, then what is the protocol for treatment? You said if you're stage 1, just radiation may be enough to, help you get rid of cancer initially. But majority of the cases are 3 and 4. Then how do you treat? What is the prognosis? What is the survival rate?
So, what I told for stage 1 is for a very specific subgroup of stage 1. For those who have tumors which is localized to the lung and which are less than 3 centimeter, only in those patients a special form of radiation therapy can be given. Stage 2 and 3 are largely patients who have either a bigger tumor in the lung or who have a, a tumor in the lung along with certain lymph nodes in the chest. In these patients, we either try to operate and remove the tumor. Once operated, if the tumor is found to have certain high risk factors, and by high risk factors, I mean factors which put the patient at risk for relapse, then it is followed by chemotherapy and or radiotherapy. For patients who have such a big tumor that it cannot be resected, or as I discussed before, a lot of these patients are old and they cannot withstand that major surgery. In those patients, we offer radiation therapy to uh, to try to kill the tumor. So, for the early stage disease, which is localized to the lung and or the lymph nodes in the chest, our first attempt is at surgery. If the tumor is too big that it cannot be resected, or if we feel that the patient will not be able to withstand such a major surgery, then these patients can be given chemotherapy along with radiation therapy.
And ma'am, what is the survival rate?
So for stage 1 will be around 70%, but as soon as we go to stage 3, it drops down to 30 to 40%. So out of 100, only 40 are completely cured. By completely cured means that the disease is gone and the disease does not come back for the next 4 years. In the rest 60, either some disease is left behind or it goes and it comes back again.
All right, Dr. Prasad, we've got another question from a Facebook user. The question is, how fast does lung cancer grow? Can annual or regular screenings help in early detection. Now, I just want to add one bit of my own here. Now, my friend's father uh, used to have annual checkups. And he cleared his annual checkup, but a few months later, he was diagnosed with an aggressive form of cancer. I think it was throat cancer, larynx, or something. And he passed away an, another 9 months later. So, can annual screenings help? I mean, you may just miss it by another few months. How do you, I mean, can there be a foolproof screening?
Yeah, I think that's a very good question from the user. So, the speed of growth of lung cancer depends on which subtype of lung cancer it is. The fastest of them all is the small cell variant, and the next would be squamous cell and then adenocarcinoma. Even in that, there is some subclassification. I don't think the details are required. But the point is, compared to many other cancers, this is reasonably average to fast growing kind of disease. Therein comes the question of screening. I did make it a point to say that breast cancer, the interest is so much in breast cancer because of the availability of screening. Breast cancers are much slower growing compared to other cancers. Hence, if you do an annual checkup, a mammogram is easy to do, ultrasound is easy to do, you can pick it up early. Also, you can palpate yourself and pick it up early and go to the doctor. So all these points are not there in many cancers of our body. Just like how you pointed out the throat cancer, lung cancer, ovarian cancer, stomach cancer, virtually you just cannot pick them up early for many reasons. One, they grow much faster. So if you do a screening this December and the next screening next December, the chances are interval cancers will develop. That means cancers can develop within this period. So the fruitfulness of screening comes down. Secondly, the ease of screening is not there. So how are you going to do a screening of the lungs? Just like you said, one of your relatives underwent a regular annual checkup. Most of these annual checkup are aimed at blood pressure,
Mm.
diabetes, routine infections, sometimes colon cancer. You look for blood in the stool. Then you look for tuberculosis. So these are the things which are looked at. Cholesterol, very few of those whole list of screening is actually aimed at cancer. Maybe a PSA level in a male, maybe a cervical examination to look for early uterine cancer in a female, and mammogram are the only things done. But what
Mm.
about stomach cancer, esophageal cancer, intestine cancer, lung cancer, throat cancer? So because of the fact that these cancers are fast growing, and also because of the fact that these cancers cannot be picked up by simple blood test nor simple X-ray and ultrasound. They require higher end imaging like CT scans or scopies to pick up early. Hence, doing screening for these has not found to be useful. Not that we have not tried.
Mm.
There have been a lot of trials wherein attempts have been made to use various modalities to try and pick up these cancers early. Most of the time we have failed. So yes, these cancers are faster growing, more difficult to screen, and hence no screening is available.
That's quite a shame, actually. Dr. Nidhi, Dr. Prasad said that the small cell lung cancers grow pretty fast, but are these small cell lung cancers mainly found in smokers? And when it comes to adenocarcinoma, um, are these always in non-smokers? I mean, can you talk about the classification of different types of lung cancers? And how are they treated, and what is the prognosis in the different kinds of lung cancers?
So, largely, lung cancers are divided into two groups. One is small cell lung cancer, and one is non small cell lung cancer. There are other varieties like carcinoma, but those are very rare, and I don't think it's a good use of time to go into those details. Um, Small cell lung cancers are almost always found in smokers. In fact, my consultant during my training used to tell me that if a patient with small cell lung cancer says he is a non smoker, you should ask his family members if he's speaking the truth. So, small cell lung cancer is almost always found in smokers. The non-small cell, among the non-small cell lung cancer, again there are squamous cell carcinoma, adenocarcinomas, adenosquamous, large cell, different types, but most common are squamous carcinomas and adenocarcinomas. Among them, squamous carcinoma is again seen more commonly in smokers, and adenocarcinomas are more seen in non-smoker. Doesn't mean that adenocarcinoma cannot occur in smoker. But if I have a patient who is a non-smoker and is detected with lung cancer, then I would think that he is more likely to have adenocarcinoma as compared to squamous carcinoma.
All right. Dr. Prasad, the one question coming in from our user is, can lung cancer return to the lungs, like how Dr. Nidhi described, stage one, with radiotherapy? The likelihood of the patient recovering completely and not having a recurrence is high. So, if a recurrence happens, does it always happen? It has come back to the lungs. How does it work? Because even with breast cancer, if it recurs, it can recur anywhere, your liver, in your brain. So, can lung cancer return back to the lungs or elsewhere?
Yeah, it can. It can go anywhere. It can come back in the same lung. It can come back in the opposite lung. It can go to the brain, the bone, the liver, the adrenals. These are the common sites where it goes. But yes, the answer to that question is it can come back to the lung and in both the lungs.
All right. So that risk remains. And while Dr. Prasad has explained to us how screening is not a very effective tool for detection of cancers related to deep-seated organs, we have a question coming in from a Facebook user. And Dr. Niti, I'd request you to answer this. The question is, do you feel that is why the government doesn't invest in screening, assuming it's intensive? I mean, is the cost a deterrent, or is there no effective screening for cancers like this?
So, even if we are talking about all the cancers uh, at large, then the government will invest in screening program one if it um, is extremely beneficial for the patients. That is, it makes a large difference to treatment if detected at an early stage versus later stage by screening programs. And secondly, the ease of administration. So for mammography, you can have a mobile van which will go from village to village and screen women. For a pap smear testing uh, we usually use pap smear testing for cervical cancer, but an investigator from India just applied some acetic acid to the
Hmm.
genital region and could detect cervical cancer at an early stage. So it is not only about the urban population, it is also about the rural population, and that is where majority of India remains. If we keep this option aside, then also even in US, um, what can screening is free of cost for everybody. It is you do not require to pay for screening. Then also there are only certain screenings like breast cancer screening, colon cancer screening, prostate cancer screening, or cervical cancer screening, which are considered a part of screening program. Because as Dr. Krishna Prasad rightly said, there is no data to say that screening in lung cancer will prove of any benefit. There is no point. I think if we do CT scans of patients who are not even smoking, I will expose them to radiation more and will be a risk factor for lung cancer rather than detecting cancer at an early stage.
All right. So, screenings perhaps have other reasons why it cannot be used effectively for detection of lung cancer in early stages. Dr. Prasad, what is science now telling us? Because during the breast cancer talk, we understood that many targeted treatments have come about, and the science is making new inroads in how you find out the biology of the tumor and you treat the tumor according to its biology. Now, if for deep-seated organs like the liver or the lung, where you can't have screenings, could there be tumor markers or liquid biopsies that could be of help? Could these help to detect lung cancer and similar cancers earlier?
Yes, it is possible, but I think we are a few years short of that. I think it will take some time before we come up with these tests which can pick up these cancer cells early. But
You're
at the
saying
present moment, no.
you're saying that technology is not available. Are you saying the data is not strong enough? Where are we lacking now?
The data is not strong enough. Technology is available, but it is not easy. Because say, for example, you compare cancer to something like a heart attack or the heart problem as such. So the major focus on heart problem is easy because you can educate people about what is an heart attack, what are the symptoms of heart attack, and how you can pick it up early. Whereas cancer, it is not so. Cancer can occur from anywhere in the body, from head to toe. So not only is it more difficult to educate and pick up cancers early, even at the molecular level, it's not going to be easy to pick up all the cancers which we want. You may pick up, start doing liquid biopsies and picking up one type of cancer early, but you're not going to make a big difference unless you really pick up most of the cancers.
All right. So we need more data and more research into this before these can be used more effectively. Then, Dr. Prasad, if I want to help myself by not getting lung cancer at all, maybe I should move to the mountains where there's no pollution and things like that. But in the real world, where people have to make a living and live in big cities with large vehicle emissions, what can we do? What are the early signs that we must watch out for, so that if we feel that something is amiss, we present ourselves to the doctors in time?
Yeah, I think the first option is the best option. However, being realistic, there is no early sign. That is the important point. There is no early sign for lung cancer at all. You should be plain lucky to pick it up early. For example, you start having cough, you go to the doctor. How many of the time you're going to have lung cancer? It's very, very minimum, very, very rare. So you're not going to get a screening done. So, for example, imagine a small 2 centimeter lung cancer develops. You should be lucky in where the lung cancer is positioned. For example, if it is centrally located, it will be hidden by the heart. So a normal X-ray is not going to pick it up. So who are those lucky people who end up getting stage 1 lung cancers? These are the patients who have undergone, regular checkup for some other reason. They have undergone an X-ray for something else, and you just pick it up. So to reiterate, there is no symptom which is suggestive of early lung cancer. Most of the symptoms are non-specific. Virtually all are non-specific. And some symptoms, say, for example, hoarseness of voice after you have coughed out a lot, may always suggestive of an advanced disease.
Right. Then, what can we look forward to by way of treatment if we are going to get majority of the cases in stage 3 and stage 4? I remember reading some data on a US website where they did a case study of an athlete. There was a female athlete who ran marathons regularly, and she was diagnosed with stage 3 cancer of the lung, but she made 100% recovery. So I feel I don't really recall what were the treatments given. I think she was part of a new trial of a new drug. So if we are going to get majority of the cases 3 and 4, how can we improve their life, give them more years to live?
Okay, so if you take stage 3 and stage 4, where majority of our patients are, surgery is out of question. So what has happened is, in terms of radiation for stage 3, lot has changed. The way radiation is given. Previously, we used to use cobalt source as the machine.
Hmm.
Now we have linear accelerators in virtually every nook and corner of the country. So linear accelerator machines give radiation in a much more advanced way, in the sense they are able to give higher doses to the cancer and lower doses to the surrounding organs, since the side effects are less. So in one, the radiation technique has improved significantly. In addition, forms of systemic treatment has improved. Systemic treatment, I mean treatment which goes all over your body. For example, chemotherapy drugs have improved significantly. Now, most of these adenocarcinomas which you have talked about are treated with a drug called pemetrexed, which does not cause hair loss. So the first thing which comes to everybody's mind when we tell chemotherapy is hair loss, especially like you said that a lot of female patients are getting lung cancer, and obviously hair loss is a major issue. So if you're going to even give chemotherapy, drugs have improved so much that there is no hair loss for adenocarcinoma chemotherapy. The next is like I think Dr. Nidhi has already pointed out, we look for mutations in the tumors. We do a biopsy, send the biopsy, look for some specific mutations, mutations which actually drive the cancer. What does it mean drive the cancer is the tumor is totally dependent on that mutation to survive. So something goes wrong, a mutation occurs, but if you are able to block that mutation, the cancer cells die. So there are 3, 4 mutations which madam has already alluded to. If the patient has got those mutations, and the chances of these mutations being positive is higher among women and non-smokers, you can give simple oral drugs, no need of injections, and these simple oral drugs have minimal side effects and is easy on the body. Finally, there is something known as immunotherapy, which has come up in a large way. So these are drugs which do not go and kill the cancer cells. These drugs actually help your immune system to kill your cancer yourself. So these are a lot of advances which have occurred. But mind you, these are all advances in stage 3 and stage 4, where the cure rate, in spite of all these things, are very low. However, the quality as well as quantity of life have significantly improved with these advances.
All right. So at least there is one silver lining there. Dr. Nidhi, we've got another question coming in from a Facebook user. The question is, do you feel warnings shown in movies against smoking has made any dent, whether these are in cinema halls or even on television? We do see disclaimers, uh, when movies are running. So do you think it has made any dent?
So, I will tell you an incident from my real life. One of So I was doing research on cancer in United States, and one of my close friends over there, um, she was a chain smoker, and even in minus 15 degrees Celsius, she will wear the coat and go out to smoke every 2 hours. And I used to ask her that you are doing research on cancer and still you're smoking. And she gave me a very good example. And she told that a lot of us are obese, a lot of us are overweight, and still we feel that one more burger is not going to give us a heart attack. So, similar is the condition with smoking. And uh, so I do not think that a person who has started smoking is going to change his smoking habits uh, by reading a label or by seeing
Seeing an ad.
ad before the movie. Having said that, when do majority of people start smoking? And that is between 15 to 20 years of age group. uh, there will be very few people who have not smoked till 30 years and then all of a sudden started smoking. So this is the teenage and the peri-teenage period when because of peer pressure or whatever you say, the people start smoking. And this is the same age group who will be more frequently seen in movies. And somebody who has not started smoking, that will be a good point to enforce do not start smoking. So I certainly believe that uh, though it's not a very pleasant sight to start watching a movie with that advertisement. And I was trained at Tata Memorial Hospital, so there was where what the same place where it was shot, the advertisement. But I think it is definitely a reminder for people, for the younger age group, to not to start smoking.
All right. Dr. Nidhi, a friend of mine, she used to smoke a lot. And then she had two babies. And during pregnancy, she had to kick the habit. After pregnancy, she went back to smoking. Then we nudged her, if you could give it up in pregnancy, try again. So she kicked the habit. And then she told us, I saved this much money. I said, look, you save so much money, go buy yourself a branded bag. I mean, you should incentivize. If it's not a disincentive, look at the incentives, but kick the habit. That's the best way forward. Dr. Prasad, uh, you said that for stage 3 and stage 4, we are seeing improvements in treatments, in survival rates, all of that. Um, and of course, screenings are not an effective way. What are there any lifestyle changes other than kicking smoking that can, reduce your risk of getting lung cancer?
Yeah, I think just maintaining an active lifestyle, making sure that the walk in the garden or a jog in the garden is continued, and look at your working environment. If you're working in an environment where there is a lot of pollution, maybe you need to make sure it is well ventilated.
Okay, ventilation can help. And Dr. Niti, what are the, we spend a lot of time indoors, whether we're in the office or we're at home. So what could be the indoor sources of pollution that we could try to remove so that, maybe, who knows, that could also, be a reason for lung cancer.
See, apart from the rural household where there will be charcoal burning, or say maybe people in the mountain belt or the northeastern region where there will be firewood work burning
Burning.
because of to prevent cold. Uh, so these are the only I can think of which could be changed indoors.
Mhm.
Otherwise, I don't think anything can be changed indoors for the normal urban household.
Right. Dr. Nidhi, Dr. Prasad, thank you so much for joining us today and speaking to us about lung cancer. This is our attempt to increase awareness about lung cancer. At least do what is there in your hands. Kick the smoking habit, protect yourself, because, like our doctors have said, there are no foolproof, effective screening programs for detecting deep seated cancers like lung cancer. But there are measures you can take which are in your hand that can improve your health and ensure that perhaps the risk of getting it is much lower. Thank you so much, Dr. Prasad and Dr. Nidhi, for joining us today and talking to us about lung cancer in our country, the advancements in treatment, and what patients can do to save themselves from getting this disease. Thank you so much.
Thank you.
Thank you.
Thank you all for your time. Do follow us on Facebook to get all the updates about our upcoming programs. Keep sending us your questions, and we'll certainly try to include them in our shows. We've taken up a number of questions in this show. If you have any more, just click on the WhatsApp button and send us your questions. We'll try to take it up in our subsequent show. Till then, stay at home, take care, enjoy the weekend. Goodbye, and see you soon.